Hello beautiful people, my name is Peter. Welcome to this tutorial. In this section we are going to continue with the discussion about the anti-seizure drugs. In today's class we are going to look at what we call the barbiturates. So under barbiturates we shall look at their mechanism of action, then we look at their pharmacokinetics, the side effects of these drugs, and any other information that I will put forth as far as barbiturates is concerned. So therefore, to jump into the mechanisms of action, so this drug, remember we talked about how when a person is having a seizure, we have what we call repetitive neural firings in a focal area in the brain. So what the barbiturates do is that they have two mechanisms of action. So the first mechanism is that they are going to block what we call the sodium channels that help in the propagation of these neural impulses. So they block sodium ion channels, and they also have the second mechanism of action is that they have what we call receptors on the GABA receptors. So when they bind on the GABA receptors, they are going to enhance the inhibitory capacity of GABA. So therefore they are going to increase what we call they're going to inhibit the excitation of the post neuron. So under GABA, the mechanism of action under GABA is that when they bind to these phenobarbital on these barbiturate receptors, they are going to do what we call to enhance the effect of GABA. So this is going to lead to the influx of excessive chloride ions, so which leads to the hyperpolarization of the post neuron. So therefore we won't have the so repetitive firing seen in patients with seizures. So therefore phenobarbital usually is given in children or in babies under the age of 2 months. So therefore we do not give these drugs in elder children or elders, the fact being that they cause drowsiness. So this will affect especially kids that go to school and people who do go to work. So therefore under their pharmacokinetics, these drugs have what we call the first order kinetics, whereby any increase in dose increases the concentration in the blood. And also what we see about these drugs is that they have what we call they have a high protein binding capacity. So they bind to these plasma proteins like albumin. So their concentration is a bit higher in blood when in a given amount of time, and therefore they have a longer half-life of about 2 to 6 days. So therefore it's very important for you to know when you're dosing with phenobarbitons. And they are very lipophilic. So these drugs are lipophilic. So therefore they are able to cross what we call the blood-brain barrier and all other barriers we see. It's very easy for them. So therefore, and also they have a pH of around 7 to 4. So this makes them a bit around 7 or less, 7.4 or less. So these drugs are what we call weak acids. So whenever you have a weak acid, it's very easy for this drug to be eliminated in the body when you introduce what we call an alkalinizing agent. For example, if you take a sodium citrate is going to increase the urination of the elimination of these drugs. So sodium citrate, sodium bicarbonate, and other thiazide diuretics also have an effect on phenobarbital. So there should be caution when you are giving these two drugs together. On my right side, I have a structure of the uridine structure. So remember, I talked about in the beginning chapter that this uridine structure will be referred to more as we discuss these drugs. So phenobarbital has this in place of the X. So it has this structure. So in phenobarbital, So we have only three types of barbiturates that we use in anti-seizures. So therefore we have phenobarbital, we have methylbarbital, and then lastly the primidone. So these are the only drugs we use in anti-seizure drugs as far as barbiturates are concerned. The rest are not are not so that potent, and also due to the fact that they have what we call they cause hypnosis. So we will restrict the to the ones that we have here. So therefore, these drugs do cause under subhypnotic doses do have what we call anti-seizure drug effects. So in phenobarbital, in methylbarbital, it's a prodrug of phenobarbital, whereby this hydrogen is replaced by a methyl group. So in the hepatic metabolism, the N-methyl methylating enzymes are going to take off this CH3 group or the methyl group, and then we get the phenobarbital. So, and also under primodine, in primodine we do not have this structure. It is a 2-deoxyderivative, so it doesn't have this keto group. So this is basically primodine, and primodine is known for its toxicity because of what we call the PEMA metabolite. So primodine is metabolized to this type of metabolite called phenyl ethyl melanomide. Sorry. So this is a very toxic metabolite. So that you should be cautious when you're giving this drug to patients. So therefore, we've looked at the pharmacokinetics and the structure and the relationship. So therefore, if we go to the side effects of these drugs, so we have not so many side effects of these drugs because we give the barbiturates under an anti-seizure in what we call the subhypnotic doses. So we shall see a little bit of drowsiness, but not so much. And also we have what we call the paradoxical hyperactivity. So this drug, we do not give it in children because of this effect, and also in the elderly, people. So there's also impaired intellectual function is also is another reason why we don't give it in children and elderly. And another side effect that we can see in these drugs is the hypersensitivity. As far as this structure is concerned, if you have an aromatic ring, so there is a possibility of forming what we call aromatic metabolites. So these metabolites may induce or cause what we call a protein adduct, which is elicits what we call an immune response. So therefore, we might suspect hypersensitivity, especially if a person has a history of hypersensitivity to some of these drugs. So it's you should be very cautious when you're giving it to the patients. So therefore, and another side effect is the vitamin D, vitamin K, and folate deficiency. So the more you give barbiturates for a long time, we see a vitamin D, K, and folate deficiency. So therefore, you should be cautious, or you should take note of this as you're giving these drugs. So if you have folate, if you have a deficiency in folate, then you get what we call the megaloblastic anemia. And so I think that's all you have to know about these the barbiturates. So under subhypnotic doses, we give them in anti-seizure. We use them in anti-seizure management, and in high doses, they are hypnotic drugs. So therefore, thank you very much for watching. See you next time as we discuss further the anti-seizure drugs. Bye for now.